I'm gonna go ahead and go through roll call, and I'll probably go through a second time. And I apologize for a second. I have to toggle back and forth between screens. So I apologize if I miss anyone who joins as I'm doing roll call, because I can only see one thing at a time here. So again, I'm Kim Taylor. I am here. How about Andrew?
Present.
Perfect. Thank you. Craig Davenport, I see that you're here. Correct, Craig?
Say it again.
Yes, I'm here.
Okay, thank you. James Myers? I'll come back around for James. Gail, I see that you are here.
Yes, I'm present.
Yeah, how about Jill? Or sorry, Jill will be excused today, my mistake. Chris, I see that you are here, I believe.
Present.
Looks like Lita and Lori will not be here today. Dr. Limburger?
Hear me?
Yes, now we
Good.
can. Good. Michael Shane, Lindsley, I know you're
Yep.
here.
Yep.
Mark Bullock, I know you're here. Jessica is excused. Looks like Justin, are you on yet?
He's here.
Here.
Oh, okay, perfect. Okay. Kat, I believe you are here.
She's
Is that
here.
correct? Okay. Katie,
Hi there, here.
perfect. Nancy's here. Tom is here. Liz, I believe, is here.
Good afternoon, yes.
Okay. And then Ashley.
I don't see.
Okay, perfect. Let me go back around one more time. James? Okay, it appears that everyone, aside from those 4 folks excused, are present for today's meeting. So let me toggle back to my meeting here.
3, 4, 5, 6. We have a quorum.
So welcome, everyone. Thank you. This is our first meeting of 2023. Happy New Year. All right, let's take a peek at the minutes that were sent to you from September. If we could take a look at those, bring up any errors or corrections, that would be wonderful. I'll give you just a couple of moments, and then if I could have a motion to approve as well as a second, that would be great.
I like the motion to accept.
Thank you, Shane.
Need a second? Somebody want to second it?
Second.
Thank you.
Perfect. Who was that? Was that who seconded it?
Chris. Oh, Craig, okay.
Craig. Okay, thank you, Craig. Appreciate it. Okay. Approved and seconded. All right, let's go to new board member update. Gail. Want to tell us about yourself? We do know you.
I hope you know me. For a while, I was the behavioral health ombuds for this region. Prior to that, I worked for the BHO, but now I work for Pure Washington, and I'm with the Office of Behavioral Health Advocacy. And it's been my pleasure now to be a part of this Board of Behavioral Advisory Board. I think there's some cool things coming up on the horizon, hopefully for our region and for our state. And, you know, I'm just glad to be here. I've been around for a while, so.
Yeah, thank you. I appreciated getting, and I know you're next up on the agenda too for presentation, but I appreciate getting the flyer on the new monthly forum. So Gail, welcome. And how about we will move right into the presentation as well.
All righty, well, thank you very much. I appreciate it. I believe the next forum is February 8th, and there wasn't a place to put that, but it is the first Wednesday, the second Wednesday, I'm sorry, of each month. And it's just kind of a way for us to put another listening ear to hear what's going on with folks, what's happening, what's not working, what's working. You know, like for instance, last week at the SISPERT meeting, the Family Youth System Partnership Roundtable, meeting, there was another discussion about transportation issues for Medicaid. I was trying to get them back and forth to their appointments, and I would definitely count that as a regional issue. But you know, it's what's working, what's not, and then we take those comments, de-identify, we don't use names, and then we roll them up into recommendations, or you know, just what we've learned to the state. I think that it's going to be a good session. Everyone's welcome to attend. Use the Zoom meeting ID is at the bottom of the forum, and you can see the password is welcome. So I've chosen to leave it open so that I don't have to click to let anybody in. I may change that in the future, we'll see. But right now, I think that I had the first one, but it was just not enough time to advertise it or to let people know about it. And so of course it was me there, but it was a good practice to open the meeting. And I'm looking for a few more participants at the next one. And like I said, the board is more than welcome to attend. You have different ears than many of the people that I talk to. And so I think that you could bring a different perspective. But is there any questions about that? Or are there any questions?
Was so I know you said you had the first one. So is this essentially a brand new outreach method then?
Yes, it is brand new, and it'll be ongoing. And you know, if we find that the time doesn't work sometime later this year, then we might change it, or I might change it. But I think I was trying to find one, number one, that didn't conflict with the meetings that I had to attend, but also I was hoping to have it during a time when maybe kids are getting home from school and they could definitely maybe Zoom in if they wanted to. It's only Zoom, it's not in person. So that was what I was trying to consider. Also to try and not have it be later in the day or into the evening. I know sometimes meetings are better for getting parents and youth involved there, but I think we'll try this time and see how it works. But yeah. I'm looking forward to the first real one. Hopefully it'll be in February then.
Any questions for Gail? And actually, just a quick comment. If you do have your microphone unmuted, I think there is potentially some background noise. So if you're not speaking, if you could please mute in the background, that would be great. But that said, any questions for Gail?
I have no questions, Gail. I'm just super excited to see you overseeing this program and the future of it. I know it's just amazing where you're going to go because you've always been amazing forever. So I love you and I'm grateful you're in that position. Although I'm really sad to lose you, but
I'm still here.
I know.
And I just want to second Shade's response. I'm so glad that we were able to rope Gail back in. I didn't want to lose her either. I say that a lot. So I'm just so glad that Gail is in the position she is, continues to represent the regional needs of individuals who are experiencing or engaging in behavioral treatment services. So what a voice and advocacy for our region. Thank you, Gail.
Thanks.
All I can say is build the army, Gail, just like you.
Thank you.
Yeah, Gail, thank you very much. Any last comments or questions for Gail?
Oh, one last thing on the forum. If anybody wants me to send them a link to the meeting, I have it. I have a calendar link I could forward. So just let me know.
Yes, please.
I'll send that out, Ben. If you could let me know, or Nancy could let me know who wants it, or maybe I could send it to Nancy.
That sounds good. Thank you. All right. Let's move on to the next agenda item. Let's see, we have the Q3 crisis data dashboard with Katie.
Hey, thank you, Kim, and good afternoon, everybody. Let me just pull up my screen to share here. Okay, everyone can see that okay? Okay. So for our
Katie,
oh, yeah.
I had the dashboard up
Oh,
if-
great.
but
Oh,
if
yeah. No,
Do you want me to just show it?
if you wouldn't mind, that's fabulous. Thank you.
Okay,
Okay, let me, thank you.
you're welcome. Oh. Something happened here, just a sec.
Just jumped away for a second.
Ooh,
There we go. Except for now, it's,
grids.
now it is not behaving. Maybe you're gonna have to get it, because I don't know what, all of a sudden, why it did that.
Only does that when you're already on a presentation, not if you tested
Yeah,
it.
of course.
Or, you know,
Yeah.
Murphy's Law, that's fine. Happy to share. I'll put that right back. All right, here we are. So. And you can see that now, okay, is that right?
No,
Oh, that was no, sorry. Is that, oh, here we go, here we go. All right.
now I see it.
It's not up there though.
Well, here, just a sec, let me see.
Oh.
Yeah, it's not on our,
Sorry about that, 1 second here. Really wants to have this other screen here. You can see it now? Sorry, it's being a little fabulous. All right.
it's not showing on our big TV, it's showing on one of my other monitors as if I'm,
Hmm,
Do the other board members see it?
can anyone else see it?
Yes,
Looks like it's on Katie's desktop now.
let's see.
We have this week.
Yeah. Here we go. Is that sharing now? Showing now?
it's good for
Yeah.
me.
That looks
Well, we
good.
see it, we just don't see it on our big TV.
Oh, we
But
have
you got
these.
it. Go ahead.
We have these.
Go ahead.
Long one.
Uh,
We're good.
Okay, cool. Right, thanks for hanging tight. So this is our 2022 third quarter report for the crisis data dashboard. Essentially, everything of all of these metrics here are in line from our previous quarters. Of note, over within this quarter, we had previously had these numbers within our regional crisis hotline abandonment rate. As we were moving through following the adoption of the 988 crisis line, we had noticed that over, excuse me, let me grab these numbers here. Back in July, August, and September, as we were moving through the quarter, we had originally thought the numbers that we were getting from Frontier Behavioral Health was that the abandonment rate had fallen beyond the contracted amount of 5% that we were looking at. July, August, and September was a 5.1, 6.2, and 4.9, which is just under compliance, but with a quarter total of a 5.4% abandonment rate. And we had originally attributed that to with the adoption of 988 and the resources and staffing considerations and the heavy lift of implementing this new program. What we learned this was the end of October, is actually as Frontier was adopting this new system, there was originally the technology that was calculating the abandonment rate was set at the most stringent setting, so that any call that involved, if a caller were to dial in and hang up themselves within a matter of a few seconds, anything under 30 seconds, that was actually marked as an abandoned call rather than something that was just a caller initiated, etc. So all of these calls, whether it's a call was accidentally dropped or, there's just a bad connection, whatever, or somebody hangs up and calls right back, maybe again and again, all of these were factoring in and inflating these numbers for this abandonment rate. So once this was discovered and Frontier was able to recalculate those numbers, we were actually right in line in terms of our compliance numbers, just as we have been previously, which is fabulous. We do anticipate that as we're moving forward, that we will see trends in a decrease in the direct regional crisis line numbers, and that more people will be taking on and utilizing the 988 number. But for our region, we just haven't seen that yet, as other regions within Washington State. Any questions? Great.
Katie,
Okay, so my question is, I'm looking at the abandoned calls, average answer time.
Mhm.
So you're saying 5% or less, so it looks like July and August, we were over that? Would
So-
5% be 0.50? Or am I misreading it?
Oh, sorry. This would be for the abandonment rate. Oh, sorry, Justin, if you want to.
yeah. So that's 0.7% and 0.69%. The abandonment threshold for outside the
5.0.
contractual expectation is 5%. Yeah.
Yeah,
And-
5.0.
And back in July, it was above that. What we're saying is essentially the stringent requirements that the system was putting on there was not correct, which was adjusted to reflect more accurate representation of the data being collected. So it's good news. Our region is completely in compliance, and we had been for a while. We were really worried about that. And then of note, you'll also see that we don't have 988 listed. That is run by Department of Health. So we don't have access to any of the 988 data. So as you've seen our numbers in the RSTL drop, the 988 call volume may increase. We are perhaps not getting or may not see what the end result is for 988. We hope to receive that data in the future, but please note trends towards 988 versus RCL are being monitored. We just don't know to what extent.
Thanks. And I
This
should have consulted my math education from years ago to realize what 5% looks like, so.
This is Kim. Please don't quote me on this. I was trying to literally earlier this morning, I was looking at one of the newsletters that comes out of the governor's office that address 988. I was actually going back to see if I could find it for purposes here, but so please don't quote me on this number, but I want to say that the data in the newsletter said something along the lines of, since the implementation of 988, that there have been approximately, I think it was a little bit under this, I want to say 600,000 calls statewide. But again, please don't quote me on that number. I'll see if I can go back and find that newsletter and maybe send it, forward it so folks can take a peek at it.
And that is representation of the statewide. The last
Yeah.
update I actually got from Front Frontier, because they actually shared some of the numbers, is we're seeing, if you scroll up, Katie,
Oh, yeah, here, let me zoom
on
in.
this, you see about 2,100 calls for the period. We're seeing about 400 988 calls. And we're seeing the trend being individuals calling 988 for themselves and people calling RCL. The primary ones are family and community members for others. So we're seeing this, it's kind of what you see in 911 and the crime check. Crime check, if you're not experiencing an immediate concern, and some individuals will call in others, versus 988 is like a 911. If you're feeling it right now, call. So that's what we're seeing is more individuals. But like I said, I don't have the current numbers for this month because we don't receive them, but it's about 400. I think the last count was 300 to 400. And then we're seeing about 3,000 on the RCL per month.
Got it.
Okay.
Katie, this is Kim again. I hate to bring this up and ask this because it would potentially add more work, which I don't want to do. At the same time, I was having a conversation with some of the numbers here with actually one of the DCRs that happens to be in my office today. and she was asking about, what the numbers look like for this quarter, say compared to, same quarter last year or same quarter during COVID. So again, I hate to request that someone do more work, but I don't know if that would be something that would be not horribly labor intensive to compile in the form of a graph or something like that over the course of the last few years, at least since the crisis dashboard has been going. So just a thought, not necessarily a direct request.
That's a great suggestion. Thank you. It's the numbers are a lot more meaningful when we know, when we're tracking back to the previous quarter and the one before. Yeah, thank you.
And again, we were just actually talking about that today. Katie and I were about making that available to the board. So I will say this, all of last year's data dashboards are all on the webpage and the including months. So data is available into last year, but you're right. A compiled list is a comparative view. That would be great. And we, when we get a little bit more of our, some time aside, we would love to make it available to the BHAB.
Got it. Thank you.
I'm gonna go ahead and second that, Kim, okay?
Cool. Thank you.
All in favor, all opposed, okay.
All right, thanks all.
Yeah, thank you very much. Appreciate it. Okay, let's move on to administrative updates. Justin.
Thank you. One of the major ones I wanted to make the BHAB aware of is that there was a slight change to our structure and our name. As we made aware in the last meeting, Kathleen Torella, as director, has left the department. And in that same process, we are working on transitioning our department to having the housing and community development be kind of a subset of community affairs, which all reports under our senior director, Kat Nichols. So not separate in terms of our overarching team. We're all team members here, but in departmental name and kind of lines of organization, they're going to be different. We were very excited to snag George Dahl from the city. He is now the HCD administrator. And so what you're going to see is our reference to Community Services Department. That is now the name of the department that oversees the BHASO, CARES, and DD, which BHAB reports and is a part of the ASO portion. So if you hear us talking about Community Service Department, housing didn't go away. It is the importance of it, the county finds, is significant enough to allow for it to have a separate administrator and envisioning a greater future on what that looks like that may not directly be a part of community services in the historical fashion. So just as an FYI, I'm not on the team.
George is phenomenal. Congratulations. I hope that he will occasionally pop into some meetings.
No, he is great. It's been
No,
exciting.
he's phenomenal.
Yeah, he's been exciting to work
Are we
with.
talking Judge Dahl from Veterans Court? That Dahl?
No, George Dahl came from Spokane City's housing department.
Okay.
Yeah, and you can all thank our senior director, Kat Nichols, who was able to snag him. So she did an amazing job stealing some good talent over from the city. And I should say this, collaboratively sharing that talent in a more uniform process by hiring from the county here.
Good headhunting, people.
Good save, Justin. Good save.
We don't steal people. We engage talent and find the best option in place. So that's one of our major updates. Again, does not change in any way, shape, or form the goal or vision that we have for our community affairs department and the community service division under that, or for the ASL. We all report to the same commissioners and the senior director. So just slight name. And then I believe the next topic is an update on our ASPER program. I don't see Josh on here. So Katie, give him a call and I'll do an update on the AOT and MRSS. And if he's not able to join, I'll turn it over to you. So I'll do a quick update on the AOT and MRSS. And the AOT is the assisted outpatient treatment. The law changed last year, so we wanted to give you an update on that. And then on our mobile response and stabilization services. And these are the two programs we brought before the board before, but we really wanted to just say, hey, here's a status update on what's going on. So the AOT was as part of the least restricted alternative the state passed. It's been in effect for a couple years now, but they enhanced it last year to add more engagement from the community. And then they also allowed for community members to make referrals for AOT. So the question might be, what's the difference between AOT and an LRA? So traditional LRAs are ones where people are consistently being detained on the initials. They're going to their 120 hour, they're going to the 14 day, they're 90-180, they're 90-180, and then the court determines, or the behavioral provider determines, hey, this individual probably should be in a structured environment where the court can remand them back into care if they're not following through with their treatment based on their current function. So they created a secondary one saying that's restrictive. Let's do one that works with them in their outpatient provider. But then they found no one was using it because there wasn't a lot of teeth. So they added more ability for behavioral providers as well as the court to remand them back into custody. It's called revocation. Instead of having to do a whole nother initial detention, you can actually just say, hey, you're not following through, revocate, put them back into treatment. But it did so in a more structured manner, and then also requires that there's more long-term engagement with the outpatient provider. So it's supposed to be a greater partnership for the individual. In the process, they found that there were certain things that need to be changed. So in this new legislation, they're asking for additional clarity. But until that occurs, our AOT coordinator, which came out of that, has been working diligently to get providers together and build a network to supply for the court. The court, I will say, for Spokane County was on the ball. In fact, they got all their forms done as part of this process months ago, and the state took those and used those for a lot of their stuff. So our court was on the forefront. Essentially, what this allows is hospitals, behavioral health providers, and substance use treatment providers to actually make a referral directly into AOT. Problem is, there's other safeguards and measures that prevent them from getting right in there. Meaning, let's say you are a treatment provider. You've been working with this guy and you're like, hey, Billy Bob needs to be in treatment. And I really firmly believe this. I'm the treatment provider. Instead of having to make them go to the court or DCR, I'll make the referral. So I make the referral, set the paperwork in, but then it requires a primary care provider or a nurse practitioner, medical doctor, or a PA to sign off on. Well, we all know most behavioral providers in the community don't have a medical provider on staff. So where are they going to go? The hospital. And the last thing we want to do is put a bit more restrictive. So on behalf of hospital providers and community providers, we said to the state, revamp this. Allow a behavioral provider who is an MHP to just make the referral. They don't need to have a doctor sign off and potentially harm smaller communities where they don't have doctors. Just have a DCR and other providers sign off and the court certify. So that's going through now. But in the meantime, we are putting the information out, we're referring them, and our AOT coordinator is building up that network. So I think we're one of the only regions, BHA ASO regions, that have hired the person and are building that, other than King County and Pierce, that they were given extra money for it. We were not. And so I think we are on the forefront, even though technically we have yet to see many AOT come through. So you're going to see more of that come out, but I wanted to give an update on that.
Congratulations also on getting Ashley. She will be phenomenal for that.
Yes.
Please
Yes.
have her come to some meetings too.
She was supposed to present today, but she actually ditched me to go to a training. And I shouldn't say that. It's a really great training. So she won the toss and she gets to go to the training and I'm giving the update. But yeah, I'm so excited to get amazing individuals. And Ashley's one of those.
Yeah, phenomenal. Thank you.
Can I ask a question, Justin? Did
Yeah.
you say that we did not get the funding to put people with peer support, people that are in that program?
So yes, what King and Pierce got was additional funding to support the services. So this is kind of how the law rolled out. AOT is there. If a provider in the community wants to participate, they have to then use their existing contracts with Medicaid. So that's all the ownership's on the provider. The law says they can be in there for up to 18 weeks into treatment. Now, a provider has to do medical necessity. They have to have agreements. That's a lot of work on a behavioral health provider. And King County, Pierce's funding says, we're going to enhance that, actually add more to the provider. We didn't get that. But one thing I will tell you is, it just so happens that a representative last year was I was in a meeting with a group of them here regionally. And she was one of the main authors of the bill. And in passing, I was just joking with her and I said, well, it could be better. And she stopped me and she said, okay, tell me how it could be better. So we sent her a bunch of stuff, including saying it needs to be fully funded. They implemented all of those changes in her law, well, most of them, and has a footnote for funding. So I'm confident if that passes, we'll get additional funding to support incentives for behavioral health providers to actually be sufficiently and sustainably funded to provide the service, which ultimately benefits individuals in a safer environment. So that's the update I have for you on AOT at least. And
Folks, any additional questions on that?
Oh, I end up working and have been working with clients that are recipients of that, right? That are unwillingly participating in the system, okay? And the biggest loop that I see where we're missing a lot and we're wasting a lot of money by sending them to the hospitals is not having Gail's people and the peer support specialists walking with those people, taking them to meetings, taking them to resources, and actually walking them through it, because then they don't fulfill what they're supposed to do. And then the cops have to come out and the professionals, and then it costs money, and then they got to go to the hospital and they got to be detained. And we just keep doing this cycle, and it's an enormous waste of time and money, and the outcome is horrible, you know? And then the other thing is we need an educational process in the hospitals and the facilities. These MSWs don't know that they're MHPs. They do not know that. They do not know that, and we need to educate them on that. And that is a really simple process.
I think those are good comments, Shane. Thank you.
And if there's no other questions on the IT, I'll give a quick update on MRSS. So the MRSS was the program that we got a grant from SAMHSA. We competitively worked with Healthcare Authority to get this grant. We were one of the regions to get it, which is exciting. But there's a lot of questions that came out. The MRSS is a continuation of crisis. So we recognize crisis is about 72 hours. 72 hours when an individual calls in who's crisis to have the initial crisis resolved, or at least reduced to the extent at which they're able to not be in the need of immediate follow-up. But the current research and historical best practices look at long-term. People don't just have 72 hours and they're done with the crisis. They have precipitating factors that they need to put into place that go long-term, up to 52 weeks. So this grant allows for existing funding to extend up to 14 days without needing to meet crisis. Currently, if we do an H2011 under the HCPC codes with Siri, it means a crisis provider can only go out within a 72-hour period, and then they have to stop and wait till they're back in crisis again. This allows us to say, no, people are much more complex. Let's go meet with them in the community and follow up and prevent it by doing stabilization. And this was exciting because it's for children, youth, and family. Here's the problem. The state never allowed for the Medicaid portion to be included as part of that. And so when we were working with our provider, it was, again, a split system. They would have to bill out the Medicaid portion, and then we could only pay for non-Medicaid. It means that the individuals who are receiving the service would have to be asked every single time. They'd have separate sets of services with each contract. It became cumbersome. So we told the state we would want all of the Medicaid in or all out, but it doesn't work to split everyone up and bifurcate. The state said, great idea, let's work on this. So we're finalizing those conversations. They have to go through a lot of process. But I believe we're at a point where we we'll be one of the only regions including that in the contracts with Medicaid. So now we'll have expansive care for everyone. For me, I'm not going to put in a program that doesn't serve everyone. That doesn't make sense, right? We're not going to exclude certain individuals. And so our provider has been waiting in the wings. We hope to get this started in January, but they're still waiting on these final discussions on billing for Medicaid plan. But I think we're at the final stages. So once we get in place, it'll be a 6 to 7 member team sending out specialized children, youth, and family providers to do stabilization beyond the 72 hours and to prevent hospitalization crisis, focusing primarily on mental health care providers. So we're talking like bachelor's level of lived experience and peers. This is going to be a peer-led experience with individuals. Kind of Shane, talking with you said earlier, and what the BHAB has expressed throughout the time we've met is we need to look at different ways of approaching individuals. So that's what we're going to be doing, as long as the state agrees for that funding, because again, peers are not compensated effectively. And so with this funding, we can further expand it. So I'm hoping to give you better news at our next BHAB, but I'm telling you, I'm finally on the final step. So that was our brief update on that.
Thank you for being proactive rather than reactive, Justin. Thank you very much. It will save millions of dollars and be a much better outcome.
So any questions for Justin regarding his administrative updates, any of the 3 updates?
If not, I think Kim,
Okay.
the last one was Katie was going to give an update on this school-based expert program.
Yeah.
Yes, thank you. Yes, so very exciting news with the Initiative for Student Wellness, SB ESPERT, which stands for the Screening, Brief Intervention, and Referral to Treatment Project. Initially in October of last year, we began working with the West Valley School District within 2 schools, a middle school and a high school, Centennial Middle School in West Valley. We began submitting the screener and moving through both schools. Everything was just successful and a really supportive staff and really engaged counselors and just support team to be able to get everything through, and being able to have so many students engaged and screened. The goal was to screen kids and refer them to treatment if needed for 1 grade in each school, and we're on target to meet that. Since then, our latest news is that we've begun working with ESD 101. Their contract began at the beginning of the year. And so we are just starting to get things off the ground in terms of moving forward with hiring interventionists. There will be 1 for each school. There's a Riverside and Freeman, and they're more rural areas. And so the middle school and the high school are on the same grounds. One of the benefits of working with these schools is historically they haven't had counselors of any kind embedded, or therapists of any kind embedded in the schools. And so in addition to being able to submit these screeners, which take a point in time snapshot of kiddos and how they're feeling on a particular day, in about 15 to 20 minutes, they are asked questions about sleep hygiene, about suicidal ideation, anxiety and depression using the GAD-2 and the PHQ-2. And from there, there's a tier system where kiddos who are screened at the highest risk, tier 3, are referred immediately to, they're flagged, and the interventionists reach out to them by the end of the day to make sure that they're being taken care of, referred to the appropriate the treatment, et cetera, as needed. One of the really cool things is that the intention of the screener is to catch those kids who are flying under the radar, who are maybe presenting that they're just fine, they don't have problems, they're getting good grades, their attendance is adequate, and so they're not maybe having the externalizing behaviors others might. That's really getting other kids the attention and the support and the resources that they need. And so now in working with ESD 101, it's great because just like the West Valley School District, they're just so excited about adopting this program, and they are raring to go, and they're very excited, and they just want to immediately, like, how quickly can we do this? And they're like, we think in 2 months we're ready to go, which is exciting, and I appreciate their moxie. And we want to make sure that we're focusing on doing things well rather than quickly, but really just everything with the success of the implementation thus far in the West Valley School District, we anticipate that we're going to be implementing things in a pretty efficient way. And are any questions or?
Actually, I think that's a really great idea for the rural areas, particularly since the middle and high schools are on the same ground. So that's phenomenal. That's great news. Thank you very much.
Sure.
Folks, any questions for Katie?
Thanks.
All right.
everyone.
Thank you. Appreciate it. Okay. Let's see. Next on our agenda, we have Tom and the CCP.
Well, I have here the CTP minutes from September, October, November, and December. First, I'll do September. At this screen, our guests are Gail Cole of the Behavioral Health Ombuds and Kaylin Roy, a liaison to SRBH, ASO, and CCP. Brent Smith, the chair, facilitated the meeting. Also attending our CCP members Aaron Smith, Tom Goff, Sarah Lake, and Robin Sanger. Vlad Lucan had an excused absence. Deborah Jansen was also absent. The online September CCP meeting was called to order. The August CCP meeting minutes were read and approved. There was no August Behavioral Health Advisory Board meeting, so this was not reported on. Gail gave the ombuds report. She said that she does not have the third quarter ombuds report yet because she only has the July and August information. She needs the September information also. Gail said she will email the ombuds report. Gail also said that she will be attending co-occurring SOAR conference. She said she'll be manning the booth at the conference. Kaylin said he will attend the conference virtually. Under old business, we mentioned that we should receive the wristbands and buy keychains pretty soon. It was also mentioned that CCP can have a table at the Evergreen Club 5K run walk. CCP wants to bring its own table and chairs. He needs to bring its own table and chairs, and there's a cost of $50 to have a booth. Kaylin said that he will take care of the purchase order for the booth. Brett and Sarah said they would bring a table, chairs, and a tablecloth. The run walk will be held on Saturday, October 22nd, 2022 at Riverfront Park in the Forestry Pavilion from 9 a.m. to 1 p.m. The CCP can possibly recruit new members of the event. Under new business, the CCP discussed doing Santa pictures again. Gail said she will see if there is a room at the library where we could do this. Robin said that we should get out notice about the Santa pictures earlier this year. The next CCP meeting will be held online on Monday, October 17, 2022 from noon to 1 p.m. Not on October 10th. Meeting was adjourned. And then I have CCP minutes from October. At this meeting, I get for Gail Coleman's Office of Behavioral Health and Kim Leroy, liaison BSR, BHASO, and CCP. Brent Smith, CCP chair, facilitated the meeting. Also attend were CCP members Tom Gold, Aaron Smith, Sarah Lee, and Robin Sanger. Vlad Lucan is not attending the meetings anymore, and it's assumed Deborah Jansen is not either. The online October CCP meeting was called to order. The September meeting minutes were read and approved. We discussed the September Behavioral Health Advisory Board meeting. At this meeting, there was a 2022 third quarter ombuds report by Gail Coble. This quarter, there were 28 meetings with providers and stakeholders and 122 information referral calls. Most of the agreement types are access. After this quarter, Gail will be the program manager for the Eastern Washington region. There is a presentation about 2022 quarter two crisis data dashboard by Justin Johnson. Justin said that the data is not quite right, but they had most of it. There were 211 high utilizers, 4,825 individuals served, 11,095 crisis hotline calls, and 13,130 services provided. There was also an administrative update by Justin Johnson. He mentioned that hosts provide stabilization service to the homeless and those at risk of homelessness. SBIRT continued services for substance abuse involvement, and MRSS addresses the problem of child youth and family and has a 5-year grant from SAMHSA. Under old business, Brent said he had the wristband to order that we can pass them out at the Evergreen Club 5K run walk. Brent said that he and Aaron have a pop-up tent and a table for the event, and the booth has been purchased. Brent asked someone to bring John June flyers to the event so we can pass them out to the applicants. He also suggested that applicants have leave their contact info. It was mentioned that it might rain that day. The Santa pictures were mentioned. It was suggested that CCD bring John June flyers to this event also. It was mentioned that we should pass out wristbands to the next Behavioral Health Advisory Board meeting. He'll give the Office of Behavioral Health Ombuds report. She said that she doesn't have any information yet because the office just started. He also said that the COD conference explained changes in the insurance plan. She will have a presentation about this at the next meeting. He also said Karen will send a CCP brochure on the computer about this. Next CCP meeting will be held online on Monday, November 14, 2022 from noon to 1 p.m. Meeting was adjourned. And here's the CCP minutes from November. This meeting are guests for Gail Cole with Office of Behavioral Health Advocacy and Kevin Roy, liaison DSR, BHASO, and CTP. Brent Smith, CTP chair, facilitated the meeting. Also attending our CTP members Aaron Smith, Tom Ghost, Sarah Lake, and Robin Seger. Deborah Jansen is no longer a member. The online November 2022 CTP meeting is called to order. October CTP minutes were read and approved. There was no October Behavioral Health Body Board meeting, so this was not reported on. Gail gave the ombuds report. She said that as of October 1st, the ombuds is transitioned to the Office of Behavioral Health Advocacy. There was then a recap about the Evergreen Club 5K run walk held on October 22nd. Only a few people stopped by the CTP booth. About 5 Jot and June flyers were handed out. Nobody applied to be a CTP member. And our new business was noted that CTP would like to know about any new member possibilities. Although Gail said it is likely that if we use the free meeting room in the library for the Santa patients, we cannot accept any money. Gail said that we could possibly do the Santa patients at the Quality Inn where she works. Possible date for this event would be December 3rd, 10th, or 17th, 1 to 5 p.m. We can arrive by 10 or 11 a.m. to get ready. The inn is located at 7919 North Division. Brent said he could bring candy canes and was suggested that we bring Jot and June flyers to pass out. Gail then let us know that her new email address is gail@obhadvocacy.org. Next meeting will be held online on Monday, December 12th, 2022 from noon to 1 p.m. Meeting adjourned. Here's the CTP minutes from December. At this meeting, our guest is Kevin Roy, liaison, BSR, BHASO, and CTP. Brent Smith, CTP chair, facilitated the meeting. Also attended with CTP members Aaron Smith, Tom Ghost, Sarah Lewis, and Robin Seger. Gail Coble of the Office of Behavioral Health Advocacy had an excused absence. The online December CTP meeting was called to order. November CTP minutes were read and approved. There was no November Behavioral Health Advisory Board meeting, so this was not reported on. It was mentioned that a past CTP member, Sophia Alexander, may rejoin the panel. We discussed the sanitation that CTP intended to provide. We suggested we arrive by 1 p.m. Quality Inn, check in at the front desk, and meet the A room to get set up for pictures. Robin and Sarah said they were run by the dollar store to get candy cane. Brent said that he has a backdrop which can be decorated with Christmas lights. Sarah said that there is a Christmas tree in the main room and there's electricity on the floor and wall. Keelan said he will bring Jot and June flyers and CCP applications. It was mentioned that we need a small table to place the flyers, etc. on. Brent said that he will bring CCP bracelets. Brent also said that he would print the pictures he takes and said he is praying for the pictures. It was mentioned that the suggested donation for the pictures is $5. Most places charge $25 or $30. Her new business was noted that Robin did a good job on the CCP Facebook page. Robin said that she would like to hear from anyone about the Facebook page and that the page can go public. Our next meeting will be held online on Monday, January 9th, 2023 from noon to 1 p.m. Meeting was adjourned. Those are my minutes.
Tom, thank you very much. Folks, any questions for Tom? Tom, when is the February meeting?
I think it's February 13th.
The second Monday.
Second Monday. Got it. Okay, thank you. Thank you again, Tom.
Online.
Okay, perfect. Okay, let's take a look at the agenda. We have both board comments and election. Let's start with election for officers. Are there individuals who would like to put their names in specific to either chair or vice chair for this next year? Wait, all of you are talking way too loudly. I can't hear you.
Can we nominate someone? I nominate
Absolutely.
Justin. I would
Absolutely.
nominate Justin Johnson for chair.
I nominate Kim.
So just as a point of order, Kim, since
Yeah.
I technically am the administrative
I know.
component of it, I don't believe
Yeah.
I can be selected. Yeah.
Okay.
Yes. Shane, I appreciate the nomination. I would like to give someone else an opportunity if they'd like to do so.
I'll second Shane's nomination for Kim, especially being new to this. I think I have a lot to learn before I consider a position.
Cam, I've appreciated your leadership this year and how you have efficiently run the meeting. So I third the nomination.
Okay, all right, okay. Are there any other folks? Again, I certainly want to share the wealth. Well, I will graciously accept the nomination. I'm going to abstain from voting, so let's go ahead and vote on this motion, and then we will go to vice chair.
Do you need a motion?
Yeah,
I'll
Please.
motion. I motion. I need a second, Chris.
Have your second.
okay, all in favor.
Aye.
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 Let's see, I don't know if you all are able, I don't know, do we need an official count, Nancy? Do you think?
I think.
Like
we
meaning a
probably-
show of waves or
I mean,
something?
people could put little hands, but I
Yeah.
don't know if everybody can.
All you got to do is say any opposed.
Mhm.
Yeah.
Having none, Kim.
One abstention. Okay, all right, it is done. Okay, how about for vice chair?
Who's the current vice chair? Oh,
I'm happy to continue backing up Kim, like everyone else said. I think, Kim, you're doing a great job, and when you're not here, I'm happy to back you up and serve in your stead, but
Anyone else like to put the name in for vice chair at all? Okay, then let's, I'll move that Chris be considered for vice chair again this year. Could I have a second?
You mean
Second.
Andrew?
Okay.
Andrew,
Um,
you mean Andrew.
Yeah, Andrew.
There, Andrew,
Okay.
excuse me. I was looking down at my notes for some reason. So Andrew, yes. All in favor?
Aye.
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 Any opposed? Okay, perfect. So be it. All right. How about any general board comments?
I just have to say, Justin, thank you for your proactive attitude and all that you do above and beyond.
I appreciate that, Shane.
Yeah.
I get paid to do all this, and my heart is in treatment. You guys are volunteering your time, so to me, it's what a much more greater sense of gratitude we should have for those that are volunteering out of their busy days to share, especially on a panel having to do with behavioral health. So I'm flattered, but I give it right back. You guys are the true heroes here. Thank you for sharing your thoughts and input. Guides me in making decisions and the leadership of our county.
Thank you. Any comments from members of the public that are present today? Okay, I'm not hearing any. Our next meeting will be Monday, March 27th at 3 p.m. Again, Zoom and as well as in person. I assume we're going to be viable options, just as this time. So I look forward to seeing you all in a couple of months. Could I have a motion to adjourn for today?
So moved.
Motion.
Yeah, everyone's all over that. Second. All right, have a good couple of months, folks. Meeting adjourned.
Thanks, Kim.
Thank you all.
Yeah,
Thanks.
bye-bye.
Everyone.
Yeah.